I am from Pittsburgh, Pennsylvania. Right outside of Pittsburgh is a ring of rural areas, and 70 miles south is Morgantown, West Virginia, and then you get into the Appalachian Mountain Territory. Within a 100-mile radius of me, there aren't, to my knowledge at this time, certified therapists outside of Pittsburgh. So if I go 100 miles south into West Virginia, there isn't a single certified therapist there. Those people have to travel to Pittsburgh. So from more of a humanist perspective, what I would love is people seeing this film, if you're a therapist, learn about EMDR and add it to your toolbox. You don't have to become an EMDR therapist. I identify myself as that. But if you understand it and have it accessible to you, you can help some of your clients heal much more quickly than having to discuss and talk and show. Not that that stuff doesn't help or not effective, but sometimes the suffering is so bad that we have to help the client faster. So as far as helping people, I want to help therapists know about EMDR if you know about it. And if you don't know about it, give you the opportunity to be introduced to it. As far as for the general population, all humans at large, I would like everyone to know about the therapy. So if you are experiencing some type of anxiety or trauma or bad memory, or know somebody who's experiencing one of those things or all of the above, you can say, hey, this might help so-and-so. And you can help find all of these individuals, connect them together so they can get help more effectively, instead of having to suffer through and through and through. If you go to the populated areas or urban areas, there's enough EMDR therapists that if you live in one of those, you're probably going to be able to either look them up in your phone book or do a search at the International Association, find someone close to you, and great. But the people in the rural areas, in the outskirts of America or in the world who aren't able to have access to this is something you could bring to your doctor, because your doctor might know somebody, or bring to your therapist and ask them if they've learned about it. And if they haven't, have them go find out about it. That's my hopes, is that a more wider range of people will have access to this effective treatment. People losing jobs, losing money, losing houses, their sense of safety in the world is being impacted in a covert way. It's not as obvious as a combat veteran coming back whose safety was clearly threatened. At least in America, we are dealing with an economic crisis. This is no secret. With that crisis comes anxieties, comes worries, comes losses that we didn't anticipate or expect. Enough losses or enough things to threaten our safety or sense of security can be equal to a trauma, a significant trauma. Is it different? Absolutely. But it can feel the same for the person experiencing it. So now is the time that we, as therapists, as a community, a world community, that we start looking at and for people who need our help and find the things that are going to work the most effectively, instead of what we think will work. Let's use what we know will work. There's enough research and data to show, to have evidence that EMDR works. No one can question its efficacy when used appropriately.